Hello everyone, this is Vivek Chaudhary, and in this lecture we are going to cover the head and neck, the osteology part and the muscle attachments. All the contents of the head and neck we'll study. So without wasting your time, let's start the lecture. If we talk about the introduction and the osteology part, so if you talk about the contents of the neck, you can see there are so many compartments, and in those compartments different contents are present. Okay, so assume this is your neck, okay, neck part, and this is your head. So we can see there is an anterior part and posterior part, then two lateral parts. Okay, once there is an anterior compartment, another is the posterior, and the two lateral compartments are there. So if we talk about the posterior compartments, it contains 7 cervical vertebrae, as you know about, and their muscles. Okay, then if we go to anterior, it is also called visceral compartment. Okay, and posterior is called as vertebral compartment. You can see here. So if we talk about anterior compartment, it contains glands like thyroid gland, parathyroid gland. You know that at the neck region, if you see, there is a thyroid gland, parathyroid gland, okay, and thymus and parts of digestive and respiratory tracts. You know there are 2 tracts that descends down from the mouth. That is your one respiratory passage, and there's a food passage, that is your trachea and your esophagus. Okay, so these are the compartments of the neck. If we talk about neck in brief, so neck also contains pharynx and larynx. What do you know about this? Pharynx, you know, it is the portion which connects, which is the common link between the food pipe and the windpipe. Okay, after that, larynx is in the windpipe, and it is also called as the speech box, as it is used for phonation. So there are 2 posterior nasal openings, one opening of mouth, and lowest is opening of inlet of larynx. These parts are called nasopharynx, oropharynx, and laryngopharynx. Okay, so pharynx is also divided in different parts according to its position. The part of the pharynx that is, like, you can see, this is nose. Okay, just assume this is nose and this is the pharynx. So the pharynx which is near the nose, that is called nasopharynx, then which is near the mouth, that is oropharynx, and the near the larynx, that is called laryngopharynx. Okay, if we discuss the basic introductory functions of head and neck, so it is written that it protects the brain, endocrine glands, and the special senses. Okay, then the neck gives passage to food and air and connects their upper part and respective lower parts, and it produces speech. That is basic thing. Then we'll directly go to the regions of the skull. Okay, so if we talk about the regions, you can see there are so many regions are present. So if let's we'll make a skull, like assume this is a skull. My diagram is not that much good, but basic example, here is eyes, the ears. So we can see there are frontal region, what it depicting that the forward part, we can see anterior view, that frontal bone is present, that forms the frontal region of the skull. Then if we talk about the parietal region, parietal is called the top part. Okay, I am mentioning here PF, frontal region, parietal region, that is the top part where parietal bone is present. Then there is occipital region, that is your posterior part. Okay, this is occipital region. And then we say temporal region. Temporal is their lateral part. Okay, both the lateral side of the skull, there is temporal region that is formed by the temporal bone. Then there is 2 regions are there, ocular and the auricular. Ocular is the region around the large orbital openings containing the precious eyeballs. You can see ocular word is mainly for the eyes. So if you know that a round circular opening is there where our eye gets embedded and set in our skull, that is your ocular region. And if we talk about the auricular region is the region of the external ear with external auditory meatus. Okay, the ear region where you collect the voice and listen. Okay, so this is the auricular region. Study the skull, there are different views from which we study, like the osteology and the muscle attachments. So if we talk about the superior view, we say it the Norma verticallis. Okay, then if we talk about the posterior view, so this is Norma verticallis, This is Norma occipitalis, that is a posterior view. If we talk about the anterior, that we call Norma frontalis. Okay, then the two lateral part is there, your Norma lateralis, and the basal part, that is your most important, Norma basalis. Okay, so we'll discuss one by one each of the views and see the structures, the features, and the muscle attachments. Okay, so starting with the Norma verticallis, that is your top view. When viewed from above, the skull is usually oval in shape. Okay, it is wider posteriorly than anteriorly. So if we see, okay, let's focus here. So this is the skull. You can see this is your anterior part, okay, A, and this is posterior part, your P. So from posterior part, it is much broader than the anterior part. Okay, so if we talk about the bones that is present in the Norma verticalis, so there are frontal bone anteriorly. So this bone is called frontal bone. Then if we put the uppermost part, that is two top bones are there, that is a parietal bones. Okay, you can see my mark. Then in the posterior part, okay, so this is the occipital bone. So there are three bones that are comprising the Norma verticalis. One is your frontal bone at the anterior part. Another two bones that are joined by a suture. This is called a suture. You can see the joining. So these are parietal bones, and the third is your occipital bone. Okay, so then we'll discuss about the sutures. So let's zoom in a little bit, then we can see the sutures very well. So there are three sutures that we are studying in the Norma verticalis. Okay, so one you can see at the anterior part. This is your anterior suture. Okay, this is the posterior suture, and in between your midline suture. Okay, so if we talk about the coronal suture, that anterior suture we call the coronal suture, that is the placed between the frontal and the two parietal bones. You can see this is the anterior bone, this is frontal bone, and this is parietal bone. Okay, so between frontal and two parietal bone, this is the coronal suture. Okay, then we'll see the middle one, that is your sagittal suture. This is dividing medially, okay, in two parts. You can see there is a suture that is called sagittal suture. Okay, then we talk about the posterior suture, that is your lambdoid suture, which is joining the two parietal bones to occipital bone. Okay, so this is your coronal suture, this is sagittal suture, and this is your lambdoid suture. Okay, this is clear. Then there is one more suture, that is a metopic suture. Actually it is occasionally present, okay, in about 3 to 8% of individuals. It lies in the medial plane and separates the two halves of the frontal bone. Sometimes here a suture comes, okay, in the frontal region. So this is called metopic suture. It is very rare, it comes occasionally. Okay, normally it fuses at 6 years of age. After that, so if we talk about some features of the Norma verticalis, first we should clear out this, and then we'll see what I'm going to say. So just focus, there's a term named here as bregma. Okay, so what is bregma? You can see this point I'm circling. Okay, bregma is the meeting point of the coronal and the sagittal suture. Okay, that is called bregma. Then another one is the lambda, that is your meeting point of the sagittal and the which suture? Lambdoid suture. Okay, then there are two foramens. You can see clearly there are two holes at the parietal bones on each side. These are called the parietal foramens, and the point between the parietal foramen is called the obelion. Another feature is that there is called parietal tuber, that is the highest part of the parietal bone where the highest convexity is there. That point is called parietal tuber. As you can see, there are some lines are arising from this region. You can see both the sides are there. These are called temporal lines. Okay, it arises from the zygomatic arch from the frontal bone and runs backwards and upwards and then continues to the zygomatic arch. You can see there are two lines, okay, arising from there. So one is the superior temporal line and one is the inferior. Superior is not continuing farther than the parietal bone, it diminishes here, and inferior line is completing the zygomatic arch. Okay, so this is the temporal lines. After that, there is some discussion about the fontanelles. Do you know about fontanelles? Guys, if we talk about fontanelles, fontanelles are the space where two sutures join and forms a membrane covered soft spot that is called a fontanelle. Okay, you can see here this green space. The sutures join here and formed a soft spot which fuses completely after some time, okay, after the birth. So these fontanelles are there that allow the growth of the brain and skull during an infant's first year. Okay, in between like below first year, the all fontanelles fuses. As you have seen in childs, people give different types of pillows for the children's shaping of the head. Okay, so these are due to proper closing of the fontanelles. Okay, so these fontanelles fuses at different times. As you can see that anterior fontanelles closes at 18 month and the posterior at the 3rd month, and the anterior lateral, this fontanelle, it closes at the 3rd month also. So if these fontanelles don't close at time, so this is a problem. Okay, so if we talk like if fontanelles fuse early, brain growth is stunted. If it is also early, the brain growth will be stunted and children are less intelligent. Okay, if anterior fontanelle is bulging, there is raised intracranial pressure. Okay, if anterior fontanelle is bulging, there is raised intracranial pressure, and if it is depressed, it shows decreased intracranial pressure, mostly due to dehydration. Okay, after that, the bones override at the fontanelles, helping to decrease size of head during vaginal delivery. Okay, what these fontanelles do when there is a delivery of the baby, these decrease their size. Okay, the elasticity is there that decrease the size of the head for the easy delivering of the baby. This is the important point. And we talk about the caput succedaneum, that is a soft tissue swelling on any part of skull due to rupture of the capillaries during the delivery. Okay, and the skull becomes normal within a few days in postnatal life. So you can see this picture. What happens here, like the capillaries rupture during delivery and the skull had a swelling. Okay, soft tissue swelling is there on any part of the skull. So this is the clinical anatomy part. You will go around when you practice in your clinics. So these cases will come to you where these conditions happen. One more, there is also like hydrocephalus child in which a fluid is filled in the brain cavity that puts pressure on the brain and damages the nervous tissue. Okay, so then we'll go to Norma occipitalis, that is your posterior view of your skull. So if we talk about the bones of the Norma occipitalis, we can let's focus on the diagram. So you're seeing two parietal bones, okay, and one is your occipital bones. Then we'll have sutures. Okay, so you know the sagittal suture is there between two parietal bones, and this is the lambdoid suture between the occipital and the parietal bones. You know lambda, okay, the meeting point between the sagittal and the lambdoid sutures. Parietal foramen is there. Now what you see is different is your nuchal lines. You can see here these lines, just focus. These are called nuchal lines. These lines you can observe on the skull when you study. So there are two lines. One is the superior nuchal line and one is the inferior nuchal line. Okay, you know, like the upper one is your superior and the below is the inferior nuchal line. Okay, after that there is an occipital protuberance. Okay, external occipital protuberance. You can see this point. There is a like outgrowth like point. You can touch and feel. There's a pointy structure at that point. That is your occipital protuberance. Okay, after that there are some higher nuchal lines are also there. Then we can say there is a foramen. You can see here I'm mentioning like that is a mastoid foramen. Actually it's your mastoid bone. This is your mastoid bone. So the foramen is called mastoid foramen, and there's a process. Okay, this process, if you touch the bone behind your ear, you can feel the mastoid process, and there is the foramen. Mastoid foramen is there. Okay, and like you are seeing also suture between the occipital bone and the mastoid bone. So this is called occipito-mastoid suture. Fine. If we talk about the attachments of the muscles, we can see the external occipital protuberance gives origin to trapezius, the upper part, and the lower part gives attachment to the ligamentum nuchae. Then we talk about the nuchal lines. So if I form these nuchal lines, okay, this is superior, this is inferior. So the median 1/3 gives origin to trapezius muscle. Okay, and the lateral part gives attachment to the sternocleidomastoid and the splenius capitis. Then the highest nuchal line, you have seen above the superior nuchal line there is the highest nuchal lines. So the highest nuchal lines, if present, listen, if present, provide attachment to the epicranial aponeurosis. Okay, you can see here, this is the epicranial aponeurosis. This attachment is given by the higher nuchal lines. Okay, and give origin to the occipitalis or occipital belly of occipitofrontalis muscle. Okay, so this is the occipital belly or occipitalis. This muscle's origin is given by the highest nuchal lines. Okay, so there are three places you can see: occipital protuberance, then the superior nuchal line and the highest nuchal lines. These are giving the attachments to the muscles. Okay, then is the frontalis. So thank you. Further we'll discuss in the next lecture.